Hello, Atlanta. Welcome to Coffee Connections. Good morning. And today we have someone who I have known for a better part of 3 decades, almost the entire time I've been here in Atlanta. We have today with us Ira Katz. He is the owner of Little Five Points Pharmacy, and he has been helping us take care of our needs with through the pharmacy, as well as tidbits and tips and tricks about health and well-being. And he has a whole supply of natural goods as well as the prescription medicine. I mean, if you haven't been into Little Five Points Pharmacy, you need to go. There's little gift items. You can still get VHS videos there. So we're going to let Ira tell you about all the amazing things he's been doing in the community as an independent pharmacy owner. And please join me in welcoming Ira Katz. Thank you, Ira, for being here.
Oh, thank you for having me. I think it's great. So I have been in my pharmacy 43 years. Next month will be my 44th anniversary. I am a past graduate of Emory University back in the early 70s. And so I was familiar with the area and just knew I wanted to open an independent pharmacy. And coming from New York City, where I grew up, just the idea of a community and a neighborhood is what intrigued me. And even though while I was on my hunt and looking for places to open a pharmacy and going to places like Peachtree Corners, where it was just farmland out there and two-lane roads, no lights, stop signs, maybe. All over Dunwoody, Sandy Springs, Cobb County. I mean, nothing struck me. Knowing that as development would happen, you'd have all those big boxes that would ultimately open up.
And that's what happened.
Really, yeah. And it had exactly. It's not unusual to see, a CVS and a Walgreens and then a Publix and a Kroger all within, walking distance from one another. So, so the community's been really great to me, and I thank them. I've had a lot of accolades over the years. I think it was 2017. I was honored to be the Grand Marshal for the Inman Park Festival and Parade.
I read about that.
that was really cool. And over the years, I've been pretty politically active, both at the state level and the national level, and got to know Congressman John Lewis. Actually, he would come into my pharmacy over a couple of years and give him flu shots. And every time I went up to DC to lobby for pharmacy issues at the federal level, they would always make a point to bring some of my colleagues in to meet with Congressman Lewis. He was always so cordial and welcoming and supportive of what we did in independent pharmacy around the country. So it was really cool. And I got to say, Congressman, I'm going to ride in front of you this year. And he was so excited. Good for you.
That's right. You were in front of him in the parade that year.
Right. As the Grand Marshal. Right. So that was really a cool experience. But get back to my passion. My passion is, again, to be involved with the community. So I've always felt that I treat my patients, I'll call them patients, the same way that I would want to be treated. Okay. So when I spend probably as much time out front of the prescription counter than I do behind the prescription counter. To me, that's as important. It's just as important for me to counsel patients on the prescription side of things as well as the over-the-counter side of things. And there's times where people will come in and they'll say, "Can you look at my finger? I've got this. It may look like it's getting infected. What do you recommend? What you would do?" And many times I say, "Listen, there's nothing that I think I can give you that's going to help, but I would recommend you go to an urgent care center or do a telemedicine visit. It looks like it's infected. You don't want it's now 3 days old or 4 days old. Don't let it linger." So I'm not selling a product, but I'm giving advice to a patient. And many times they'll come back with a prescription and thank me. Okay, I've actually had situations where somebody had a serious infection, and had they not gotten help within 24 hours, and the patients have said that I might have been in the hospital, I might have died from this infection. So, just little things like that.
I have a
Lately,
personal one you did for me. So when I was new on my blood pressure medicine, and I got a cold or something and was going to get some medicine. And you said, "Oh, wait a minute, Pam. No, don't do that. Use this one because this is not good for your medicine." And it's on the back of the label, and I would have read it, but you jumped in front and remembered.
well, thank you for that. And so I'm a adjunct faculty member with Mercer College of Pharmacy, and I get pharmacy students that come. And always the first day that my students come to spend, and one of the first things I say to them is that you need to remember this, okay? No matter what your practice setting is, you need to remember patients don't read, okay? And so it behooves you as the pharmacist to make sure that it's okay to be redundant and to put labels on and give information about a particular medication. But when you are face to face with a patient and explaining their blood pressure medicine or their cholesterol medicine or an antibiotic, for example, it's important for you to explain it to them, because hearing it from you, whoever it might be, and this is, again, it's not just independent pharmacy, if pharmacists in the chain stores as well. Unfortunately, they're overburdened. I have a great deal of empathy for my pharmacist colleagues that work for some of the big box stores. It's rare when a patient comes in and they have an opportunity to talk to the pharmacist.
Right.
That does not happen in my pharmacy. Okay, if somebody wants to talk to the pharmacist, they can talk to myself or my other pharmacists at the time. So that's always been important. Moving forward, as time has gone on, I got involved very early on with when we had young men getting sick back in the early 80s, early mid 80s. Yep. With the AIDS epidemic, and then of course, HIV, working closely with some doctors and getting medication for these patients. I was losing a couple of patients every single week from HIV. It was a very sad situation. So yes. Got involved with that for a good number of years, still involved. I also, it wasn't just the gay men, it was the IV drug users. So I said, as a pharmacist, I want to be, do my part and make sure that patients and people, and I believe in needle exchange programs. We're not going to encourage people to use drugs by providing them clean needles, okay? Many states have needle exchange programs, even Georgia does. And so that's a good thing. It's a good thing. And so it's not just the IV drug users or gay men or gay women and whatever. It just doesn't make, so I wanted to protect them. And now it's led me to the, I'll call it the pandemic of sorts with the opioid issues that we have today. And it's frightening. So I was very involved in getting and working with the Georgia Harm Reduction Coalition.
The Georgia what coalition?
Harm Reduction.
Oh, that's Coalition. Right. That's right. I remember reading.
First, it was the Atlanta, several years back. It was the Atlanta. They would set up in a couple of different locations and offer Narcan and free syringes. And, so I said, I knew some of the principals that were involved. I said, listen, I'm open 7 days a week, 365 days a year, many more hours than that you're around. Let me be a conduit, if you will, and provide the Narcan. And so we've been doing that for a very long time.
For those people who don't know what Narcan is, will you let them know what Narcan is?
Sure. Narcan is a narcotic antagonist. Okay, it's a nasal spray. They also make an injection. Naloxone is the generic name for Narcan. It saves lives. Let's put it this way: it will reverse an opioid overdose. With just 1 or 2 sprays of this naloxone or Narcan in the nasal spray, and it's amazing. I personally have saved quite a few folks individually in front of my pharmacy, in the parking lot. My technician has, my other pharmacists have. And so we also give out Narcan free to anybody that asks. And I've distributed Narcan to restaurants, bars, everybody,
Oh,
anybody.
that's, yeah, I didn't think about that. Restaurants, bars, that is
Yeah.
important.
Anybody that you might be an empty nester, for example, and I've had this situation, but my neighbor's got teenage kids, I want to make sure I have Narcan, and maybe I'll tell him or her, my next door neighbor, that I have it, I can give it to you, or you can go up to Ira and get it, get it.
Yeah.
So, over the years, the DEA has been very aggressive with physicians and pharmacists and all these pill mills that have been out there, closing them down, which is good. But there's a lot of people that out there that need heavy duty narcotics to function. And so I want to make sure that, these people also have, if they accidentally possibly overdose, or caregiver, to know that Narcan is there and available for them. We've documented, we believe over 1,000 lives have been saved indirectly because we provided the Narcan to people. And they'll come from all over the state. They actually come from Alabama, they come from Florida, they can, because we have it, it's free. Now, about a year and a half ago, Narcan was approved, thankfully, as an over-the-counter product. So it is available. And so I do encourage people to get it. The cost is between $45 and $50 for it. If you're in Atlanta area, come by Little Five Points and get it for no charge.
That's amazing. Yeah.
So that's been important to me. I'm working with the University of Georgia as well to provide training. Now we have 4 pharmacy schools in the state of Georgia. So now professor there, Professor Khalil, who's a pharmacist, it trains all pharmacy students on how to use Narcan. And along with that, now we've seen a tremendous proliferation of problems with fentanyl.
Yeah.
And fentanyl overdose. Fentanyl's still out there. People still use fentanyl.
Does Narcan work with that also?
Yes,
okay.
Fentanyl is an opioid. Yes.
Okay.
And so I found out a few years back that fentanyl test strips exist. And I said, so I did my research. I tried to find a company that has them. And they said, much as we'd like to sell it to you, we cannot. It's illegal for me to sell it to you in the state of Georgia. So I contacted a friend of mine who contacted the governor, knew the governor. And regardless of what you think of our current governor, he did a great thing in that he immediately, after talking to my friend, I'd given him the information about fentanyl test strips and why it's important. Within a week, I was able to buy fentanyl test strips and provide those to patients as well. Because what's now happening is some patients are not able to get their large quantities of analgesics, opioid analgesics, from physicians, because physicians, again, have been scrutinized by the DEA and by Medical Association, and pharmacists by the DEA and by their pharmacies, Georgia Drugs and Narcotics Agency. So people going out to the streets, and this is where it's dangerous. And of course,
yeah,
had all these, migrants coming in, and and these cartels providing these, we don't even know what's in them most of the time. Okay, and a lot of times they have these tablet presses. It may look like an oxycodone. It may look like a Percocet. It may look like a hydrocodone. It may look like a Xanax or alprazolam is a generic name. So people take it, and it could be laced with whatever. And so I've always, and now thanks to the governor, we're able to get it. And as a matter of fact, my association has just formed a partnership with a company to provide all independent pharmacists in the state of Georgia with fentanyl test strips, make it available to them.
So I'm not familiar with the test strips. So if someone had a pill, for example, do they just put the pill on the strip? What's the test strip? How does it used?
Okay, it actually comes in a little kit. It's got a little micro scoop and a little, almost like a test tube, a receptacle. You
Uh-huh.
put like a teaspoonful of water, any kind of water,
Uh-huh.
and you can scrape off a little of the powder from a tablet, or if it's powdered, just sprinkle a little bit of that powder in there, tiny little
Uh-huh.
bit. Wait about 10 or 15 minutes, and then you put the test strip in, and like you would read a pregnancy test, for
Your
example, or
ketones, for
COVID
example.
test, or any of these
Mhm.
over-the-counter tests, and whether it tests positive or negative. And then it's up to the individual if it tests positive for fentanyl, whether they want to use it or not. Okay. So,
Yeah.
and then there's other things that have been added to, not just fentanyl, which can be reversed by the naloxone, by Narcan. But now this other horrific animal that's out there, it's called Xylosine, which is a veterinary product. It's used
Oh
to
my.
anesthetize elephants and large animals, and why? Because it's inexpensive, so they're lacing it with all these other things. And so we have now xylosine test strips available. So, and this, and I've seen patients, they've told me that they have terrible wounds. It just eats away at human skin on their arms and their legs. It's a horrific situation. So,
Ah,
so that's been a focus
yeah.
of
So,
mine.
I mean, like if they're going to be using the drugs, you cannot stop them, but at least say that you have safe needles so you're not transmitting diseases, um, and protecting yourself as much as possible if you're going to be using that. And then the other is testing for the laced things.
You know, the whether it be fentanyl, whether it be xylosine, or something else that might even be in there. Now, xylosine is not an opioid, so if it's fentanyl, it can be reversed by Narcan, but xylosine, there's no effect on xylosine. But I have a button. We wear a button sometimes in the pharmacy. It says never use alone.
Mhm.
So we encourage people to do that. We also with an 800 number to call if they are alone and they need to use. You can call somebody 24/7, 365, and they will be on the phone with you. And if they're using, if they don't respond to some questions right away, then that person will call 911. And we have the Good Samaritan law here in Georgia. So I do encourage people, they see somebody that is possibly overdosing, immediately call 911. That's the first thing you need to do. And hopefully you have Narcan available.
Thank you for pointing out the Good Samaritan law, because I do think some people are afraid to say something if they see something in that case that maybe they will think they were involved or that they did something, or even if they were with them, it's someone's life. And so
Right.
having, knowing about the Good Samaritan law, I think is good. So thank you for sharing that too.
Yeah. Well, thank you. Actually, we had a situation where a couple of folks in the car drove right up to the pharmacy, took this person, this male, and pulled him out of the car, put him on the ground, and drove away. And this person had overdosed. We were able to bring this person back through Narcan. Okay, and
Yeah.
so and we've had other situations too. And so not only do we use Narcan, we provide CPR as well. Wait for 911 to get there. The first thing is we always call 911 right away. But they
Mm.
can't be there as fast as I could be there in front of my pharmacy with Narcan and
Right,
CPR.
right.
And we're all trained with CPR. So all pharmacists are trained out. So
That's good to know. I didn't know that all pharmacists are trained in CPR. It makes sense. I mean, it would seem logical.
well,
So,
that's all stemmed from years ago when pharmacists were able to immunize and vaccinate. So,
mhm.
if somebody has an allergic reaction to a vaccine, even a flu vaccine, for example,
Mhm.
a shingles vaccine or whatever, you need to be able to administer CPR until, the authorities can come.
Well, in your pharmacy, you guys can administer flu vaccine and vaccinate other vaccinations as well, right? I know you did not mention this because you're being humble, I'm sure. Wasn't it 2021 you received national recognition from the Independent Pharmacy Group?
It was, I think it was 16 or 17 also. It was where
Okay.
I was actually named the Willard B. Smith National Independent Pharmacist of the Year. Yeah, yeah. It was quite a shock. Definitely.
And that is a peer chosen awards. Is that correct? All over
That's
the
correct.
nation saying Ira's exemplary. and
I think
your
it came
community
from
service
my,
and
yeah,
patient care.
yeah, patient care. And you know, I took one of my students a month or so ago to meet with some senior citizens in Inman Park at the church in Inman Park, and just had a little get together. I think they were 12 or 13 or 14, and just to, you know, to open up to them, because some people don't want to strike a conversation, or some people aren't available to have a conversation. They may have a caregiver, they may have a family member or something like that who picks up their medicines and just gives it to them without really counseling them. So I've always said to all my patients, anytime, pick up the phone, call us. We'll be happy to go over and bring your list of meds. Just did this yesterday. Bring me a list of your meds, and we'll go over things with you. Okay. And with polymedicine and polypharmacy, which is many different doctors and specialists and many different pharmacies, and you've got mail order pharmacies requiring some specialty meds. All the more reason why it is just like I tell my patients, you know, have your PCP, your primary care physician, your internist, whatever, have him or her be the conduit between all your specialists, whether it be gastroenterology, cardiology, nephrology, what OBGYN, whatever it might be. But that one person, so you have that communication with that key individual.
That one person
And
who can keep the big eye on everything happening.
right, and the same thing with and the same thing holds true with pharmacy. So you might have to certain prescription drug mail order service or from one of the big boxes because of these pharmacy benefit manager situations that sometimes prevent independents from carrying and dispensing certain drugs, or the co-pays for these patients could be much higher in some independents than it is, and we're fighting that up in Washington, as a matter of fact. So you know, again, I'm always available, whether you get your prescriptions from me or not. And along with that, you know, I mentioned earlier about the over-the-counter meds. I mean, whenever I see a young mom or dad or come in and they want to pick up a children's infant Tylenol or ibuprofen, acetaminophen or ibuprofen, Motrin, Advil, whatever, and I can't tell you how often this happens. And I'll say, you know, how old is your child? So I make sure that we can dose this individual. And all these children liquids bottles, especially the acetaminophen and the ibuprofens, all are suspensions. I mentioned earlier about patients don't read. It's a great example. Somewhere in small print on that box it says shake well. So a patient is holding the bottle up, and they pour out a teaspoon or 2 teaspoons and are shaking it. They're not getting, and they want to know why their child's fever is not dropping or whatever. And next thing you know, they have to go to the emergency room, and they don't know because I gave my child you know, a teaspoon or 2 teaspoons of Tylenol or ibuprofen, and they're not going to say. They just think that the patient, you know. So I can't tell you how often over the years, well, I never knew that. I never knew that. So just something simple like that.
Not only, what are the other things I love? You don't just have doctor prescribed or over-the-counter medicine, traditional over-the-counter medicine. You have herbal medicine, homeopathic medicine, alternative kind of things. And many times, again, I've been in with something that was prescribed, and then you or one of the other pharmacists will walk around and say, let's work on building your immune system too, which I've always done, but it's always just a gentle reminder. Let's do some things to support your immune system.
I appreciate you. That's a great segue, because that was how I was going to try to end this little conversation. Yeah, I have been very involved. I've gone to the natural products expos out west, east, which is now changed. But years ago, I had a pharmacist who was an herbalist, and she kind of said, we need to carry this, we need to carry that. And so I had to, you know, get myself re-educated on it. They do not teach this in pharmacy school. And it took quite a few years for me to get to the point where I am today, where I feel comfortable recommending. Not all supplements are equivalent. There's a lot of mass merchandising going on out there, and so I've always said, buyer beware, regardless of what it might be. But if it's too good to be true, if you're going to get a 250 count of fish oil, okay, you don't know, where it's been manufactured, if it's under good manufacturing procedures and protocols. So I rely on, and my patients rely on me to make sure that I have quality products to dispense to them. And then I teach my students, and they really appreciate it because I said they don't get this in school. There's a tremendous number of what we call drug nutrient depletion. So, and for example, certain blood pressure medications, it probably you take a B complex, maybe take omega 3s, maybe take something else, and the time of when you take your blood pressure medicines. You take it in the morning. What else are you taking in the morning? So there certain supplements may interact with certain prescription medications and vice versa. So I've actually stood up in hundreds of independent pharmacists, and I've said, because I want my colleagues in the country to recognize how important supplementation and that drug nutrient depletion, and I'll mention a couple of key ones in a moment, is. So I said, I like to keep my patients healthy. Okay, I want to keep them well and healthy. And I'd rather sell them a good quality supplement than fill some of these prescription drugs. But some of these prescription drugs present with all these adverse effects, and may not be necessarily a good thing if we can try to, with diet and exercise, and we give them information about that as well, and with good supplementation. So one of the keys, and when people are on statin, I can't tell you how many people are on drugs. One of the key enzymes needed by drugs is coenzyme Q. It's a very inexpensive supplement. You add that to your regimen. Some people like to take all their drugs in the morning. Well, our bodies tend to produce cholesterol at night while we're sleeping. So I always recommend take it in late afternoon or in the evening sometime. Usually it's just once a day. So just little things like that, just little things. And people taking antibiotics, even children taking antibiotics, and it's flu season. And so, we make sure if that they supplement themselves sometimes with a probiotic, okay? And as women too, especially, and men, you can get a yeast infection for women, or you can have an issue. So you want to make sure, because the antibiotics are going to kill off not just the bad bacteria but the good bacteria too. So you want to supplement, not necessarily during the time that you're taking that antibiotic, maybe just a little bit right after taking the antibiotic. Pre and probiotics, and we've got them. Some are room stable, some are refrigerated. But again, you got to be careful. Buy a good quality product. Okay, so people could do their own research now. Yeah,
I mean, people could go to other stores and get some of those same things, but they haven't been. Again, like you said, it's up. You really want to make sure that you're putting quality products in your store as much as you can find out about the product and educate yourself on it, so that what you're putting in, you feel the best about.
Even when I come out, if somebody says, I'm looking for a good multivitamin, or I'm looking for a good omega 3 or a B complex or whatever, the first question I said, do you take any medication? Now, if you go to anywhere else, even if, health food stores or whatever, I'm a pharmacist, okay? And yeah, and you mentioned it right at the beginning. I take blood pressure medicine, so I got to make sure that I understand, what are you taking? Are you diabetic? Are you taking any medications for your diabetes? These are the kinds of just, questions we, can ascertain what might be the best way for patients to go. I carry a line of electrolyte supplements, and so I picked up this line of one of the natural products years ago that
Mhm.
has zero sugar. So I feel comfortable that if a diabetic patient, if he or she likes to hike or run or on a bicycle ride, and especially in the summertime, but any time of the year here in
Mhm.
Atlanta, make sure you hydrate. So you take a good quality electrolyte supplement that has zero sugar.
Yeah.
So that's just another example.
Given that we are in the flu season right now, we're not in the hot season yet. I'm
Right.
ready.
Right. Yeah.
I'm ready. What are or even seasonally? So, like this time of the year, what do you typically recommend when people wanting to build their immune system and take care of themselves for the colder months and then the warmer months? What do you typically say to people?
Well, I usually first start with a good quality multivitamin, okay, and that's a year-round thing. So it's important to start there. Boost your immune system. I'm a big proponent. We've got a great product, great company. It's called Virusin. I have people are coming to buy 2-3 bottles at a time, and they take it year-round. And it's just got vitamin C, zinc, elderberry, echinacea, some good quality herbs to boost your immune system. Okay, so it's little things like
And I
that.
know you always recommend eating well and moving your body. You
Uh,
always do that.
right, of course, right, yeah, and some people, unfortunately, are more sedentary. So
Mhm.
I had a lady come in the other night, and she needed something a little petty cycle that underneath your desk or your table, and you could pedal so you get your legs moving.
Uh-huh.
Whereas maybe they can't walk well for whatever reason. So little things like that. Little things.
Yeah.
And we
Um,
provide. I've gotten into a little niche market with. We have a lot of home medical supplies, walkers, wheelchairs, braces, etc. Ostomy supplies. So
what supplies?
again,
What was that
whatever
last
I could
one?
do to ostomy and colostomy.
Okay. Uh-huh.
People who've had surgery and
Yep.
and need these supplies, and they're not available in a lot of places. And again, because I'm open 7 days a week, people know that we have them, and so that helps as well.
Any big plans for your 44th anniversary
No,
next month? No big
no, no,
celebrations,
no
no
big
big
celebration, no,
banners.
no big celebration. Maybe when God willing, I'll be around for 50. If I'm around for 50, then we'll have a celebration. But again, it's I I just love the community, and they've been very, very good to me. And I think in turn, I've been available to them as well. So
Mhm.
you know,
I mean,
it's
yeah, you've grown up. You've seen a lot of people grow up and come back and bring their children to you
right.
into the
Three
pharmacy.
generations now. Yeah,
Yeah,
three gen.
yeah,
Yeah, yeah, yeah.
yeah.
So that's pretty cool. And their children and their grandchildren. It's great when I see them and they come in and they live close or nearby. Yeah, that's pretty cool. That's pretty cool. So I enjoy that. Little
You were
things
the
like.
president also of the Independent Pharmacy Group, right? Or Independent Pharmacy Association? Is
In
it the
Georgia, yeah, the Georgia Pharmacy Association Academy of Independent Pharmacy. Yeah, yeah,
Georgia Pharmacy Association Academy of Independent Pharmacies?
yeah.
How many independent pharmacies are there in the state?
Yeah, well, there are 380 some odd that are part of my group, and there's probably another 100, 120 more than that. So independent pharmacy, and I just tell you nationally. So we as independents are strongest in rural parts of the country. Okay,
Mhm.
where the big boys,
The big
Walmart,
boys.
right? The big chains started. A small, 2,000, 3,000, little town. It doesn't suit their demographics to open a business there, but you're going to have a local independent pharmacy. And what's happening now with it's been going on for years with these pharmacy benefit managers and the vertical integration, because the big boxes own some of these PBMs, and we tried to fight that, and we're pursuing that with the FTC, and we're pursuing that in Congress as well. We've got 2 pharmacists in Congress now, one from Georgia, who I know very, very well. And so, you know, he's leading the charge and leading the fight. It's taking some time, but at least now getting the FTC to look into that vertical integration, which we tried to stop early on back in 2004, 2005, 2006. And when one of the big boxes bought a PBM, and you know, we just felt it, and then they kind of steer patients to their pharmacy of choice. Okay, so that has had a real negative impact. We have a lot of independents over the across the country that have closed shops over the last couple of years. And if we don't get this fixed soon, we're going to have more closures. My friend testified yesterday in Washington about we call these desert locations where at local independent, nobody's going to open a pharmacy in a small little town. Okay, if that little independent can afford to stay in business, then where are people going to get their health care? We are the most readily accessible healthcare provider. Okay, you know, we're here, we're open. People come into a pharmacy. You know, the old days, it was, you know, they call, even some people come in, the older folks say, "Hey doc, how you doing?" I'm not a doctor. Okay. I don't, and I'm so old, we didn't even have a, you know, doctor of pharmacy degree when I was in school. Now all the students over the last 25, 30 years at least have a doctor of pharmacy degree, so they can be called doctor. I'm not, but you know, it's that they come into a pharmacy because they feel comfortable coming into a pharmacy. They may not want to go. You know, urgent care centers are relatively new, you know, and we've got them everywhere, and that's a good thing. So again, more people have access, but you know, their local pharmacy is where they can, you know, where they can get hopefully the best advice. Okay, and as I said earlier, at times I, you know, will send somebody immediately to an ER, to an urgent care center, if I felt that again, I'd rather err on the side of caution, and you know, I'd rather them come back and say, "Oh, it was no big deal, just gonna give me an antibiotic, and you know, here's the prescription." I said, "Good, I'm glad you got it checked." Okay, because had you not gotten it checked, who knows what would have.
That's right, and you could have saved them right there. You never know. Possibly.
Yeah, I value what I do. I value the community of which I'm serving, and because I've been so involved with independent pharmacy, I'm not just espousing this on my behalf, but I know my colleagues from around the country feel exactly the same way in their communities and are welcomed by their communities.
I'm going to share another story. I have a few Ira stories.
Okay.
When my mom passed away, I was in South Georgia, and I started talking to this colleague, and if you're in a big box pharmacy, they have like some big mass whatever with what your prescriptions are and can change it over, and you've always been my pharmacist. And she was in hospice. It was unexpected, and I just got my stuff and went down and had to stay longer. And I'm like, "Oh my gosh, my medicine." He's like, "Let me call the pharmacist there. We will call the pharmacist here, and you guys took care of it for, you know, so that I didn't have to send someone here to drive." Like, it would have been a nightmare trying to figure out how to get my medicine. It was like, "We've got you. Come on by. Thank you so much." And it was very personal care. It wasn't cold. It wasn't through a glass. It was, "Yes, we'll make this call. We'll take care of this. We know you've got enough you're already stressed about." So there have been a lot of moments in my life that you guys have just been very kind, and it makes a difference.
Well, thank you. Thank you. I appreciate that. And this happens quite often. People move. And patient, husband-wife team been around with me for over 30 years, and they moved to upstate New York. And so I gave them a 3-month supply before they physically moved, and they had refills. I said, you know, I just say, if you can find an independent pharmacy, because I'm so used to working with, I said, find an independent pharmacy, have the pharmacist there call us, and we'll be very happy. I gave them copies of their prescriptions, and so they had information, and you know, and when time comes, we'll transfer the prescriptions. People go away. and they forgot their meds, like you, or or they dropped their meds or something, whatever. I mean, this happens all the time. So we try to, make sure. And I will tell you, people come into my pharmacy, or I get a call. My parents are visiting from out of town. My mom left her blood pressure medicine. My dad left this medicine. And, I said, okay, if sometimes on the weekend, if they have their bottle, I said, bring their bottle in so I can see what it is. Or I will try to call their doctor for them, even after hours or on the weekend. And if transfer from the pharmacy, so we do whatever we can. If I have to give them a 2 or 3 day lead, or anytime people are, I have to reschedule my doctor's appointment. My doctor, is going to be out of town, but I'm running out of my medicine. I need a 5-day supply or whatever. So these are things that we do. Okay.
Yeah.
Not for controlled substances, don't get me wrong, but
yes.
I'm not going to let people be without their blood pressure medicine,
right?
Right, or the cardiovascular meds, whatever. So,
yeah, it makes a difference. It's appreciated. It's definitely personalized patient care with community centered.
Right.
So,
and again, that's who we are as independent pharmacists. I mean, that's why we went into it. I years and years ago, I had an opportunity to work with somebody and wanted to buy and open independent pharmacies around, and I didn't want to do that because that would have put me in an office behind a desk, and that's not why I went into pharmacy. I love the interaction with the patients, and I'll kind of maybe leave this on this. I tell this to all my students as well. I said, we're in a unique situation. I said, at the end of every day, I get into my car and I said, to myself, did I make a difference in somebody's life? However big, however small. It could have been a hug. It could have been, a tap on the shoulder. It could have been just, hi, Mrs. Jones or Mr. Smith or whatever, how are you doing today? Anything, but, little things. Did we possibly make a difference? And did we save somebody's life today? And that's happened too, but it's so rewarding. It's so rewarding. And, that's what makes it so special. So that's why I have my little independent pharmacy as Little Black Boys, and I'm content doing what I do.
Well, I'm glad you're content and you have it. It's a great benefit to the community.
I appreciate that. Thank you.
Is there anything else you would like to share with us? Anything I haven't asked that maybe, or do you want to ask me?
Yeah, well, I also have a sign up there, and I said, communicate before you medicate. So I would just let people know if they're going to be using, regardless, the big boxes or whatever. Mail order is a little more difficult, but communicate before you medicate. You just never know. Again, I mentioned polymedicine and polypharmacy. You go into all these different specialists. You hope that they have your drug history correct. Lots of times they don't. Or you go into urgent care, after hours or on the weekend or a holiday, and you might not have provided the nurse practitioner, the PA, the doctor there with information. So that's where we come in. We're the last line of defense, if you will. Mm-hmm. If they prescribe an antibiotic, that might be a sulfur drug for a woman might have a UTI and a sulfur drug. Well, maybe they did respond to the urgent care person there that, hey, I'm allergic to sulfur drugs, or, mm-hmm. little things. I mean,
that could be a big thing, but yeah.
It turns out to be a big thing. Right.
Yeah.
Exactly right. Yeah. So that's who we are. And I thank you for doing this.
Thank you. I can't wait to share it with everyone. So I'm going to wrap it up here and let everyone out there know that we will have show notes. So we will mention some of the things that Ira talked about, as well as, of course, the pharmacy down below. And please go by and visit Little 5 Points Pharmacy. If you have not been, I highly encourage you to go check it out and say hi.
Yeah, thank you.
And until next time, hope this inspires you. Keep inspiring others.
Well, appreciate it. Thank you so
Thank
much, ma'am.
you.
I appreciate it.
Thanks, Ira.
Be
Bye.
well. Okay, thank you. Bye-bye.